Hello, my name is Lucy Clarke. I'm an advanced clinical practitioner and the clinical lead occupational therapist for Betsi Cadwaladr University Health Board. Today I'm going to share with you research I conducted to investigate the effect of occupational therapy on diabetes self-management in primary care. The incidence of diabetes is growing, affecting 7.3% of the population in Wales, and yet only 10% of diabetics attend structured diabetes education. The Welsh Government plans to invest in services upstream, supporting self-management and harnessing multidisciplinary teams in primary care. Whilst working in a flagship Welsh primary care practice, I began to explore how occupational therapists may support diabetes self-management in those least engaged with their diabetes care team. Occupational therapists provide holistic, person-centred interventions to improve health and well-being by enabling participation in valued activities and occupations, providing practical support to improve independence and satisfaction with living daily life. It is believed that occupational therapy can facilitate the lifestyle changes needed to support diabetes self-management. A wide review of the occupational therapy literature was conducted. Numerous studies in the United States demonstrated a potential role for the profession in supporting diabetes self-management. However, the skills of occupational therapists have not been exploited to enhance diabetic services in the UK, and there are no UK studies exploring their potential to do so. The purpose of the study was to investigate the effect of brief occupational therapy intervention on the diabetes self-management and occupational participation of type 2 diabetics within primary care. Ethical approval was obtained from Glyndŵr University, Leicester Research Ethics Committee, the Health Research Authority, and from Health and Care Research Wales. A concurrent triangulation mixed method study was conducted with 4 participants who were identified by their primary care diabetes team as having difficulty engaging with standard diabetic care. They were given pseudonyms: Simon, Mandy, Thelma, and Bob. Each received 5 or 6 one-hour occupational therapy interventions. Pre- and post-testing was conducted using 3 standardised measures: the Stanford Self-Efficacy in Managing Chronic Disease 6-item scale, the Diabetes Self-Management Questionnaire, and the Canadian Occupational Performance Measure. These were used to measure the impact of occupational therapy on self-efficacy, diabetes self-management, and occupational performance and satisfaction of participant-identified goals. Thematic analysis of post-intervention semi-structured interviews were conducted to triangulate and add richness to the results. Occupational therapy was focused around each individual's priorities and valued activities through setting personalised occupational goals. The 5 ways to wellbeing and social prescribing were harnessed to develop meaningful occupations and to increase activity participation. A detailed, holistic occupational therapy assessment was conducted with each person in their social and physical environment. This identified barriers to diabetes self-management. All participants had a poor understanding of what foods contain carbohydrates and what effect this has on blood sugar. Work, mobility, and family issues had prevented access to structured education and impacted on ability to make change. All had comorbid low mood and low self-esteem, affecting motivation. Mandy and Bob had little routine and unsupportive relationships. Thelma and Simon were restricted by mobility issues. Bob and Simon by pain and fatigue. A tailored occupational therapy intervention plan was written towards personalised occupational goals. A variety of techniques were used to overcome these barriers, activating motivation to change and enabling self-management. These included activity scheduling, problem solving, motivational interviewing, mindfulness, cognitive behavioural strategies, and pacing activity skills. During intervention, relevant skills and activities were practiced towards personal goals in small steps. Examples include setting an alarm on a smartphone to remind to take medication, reading and comparing food labels, family meal planning, mobilising with a kitchen trolley, finding ways to exercise in the local community, using crockery to manage portion sizes, and role-playing assertiveness techniques to challenge significant others. The quantitative results showed significant improvements across the standardised measures for self-efficacy, diabetes self-management, occupational performance and satisfaction with occupational performance for each of the 4 participants. For qualitative results, line-by-line coding and thematic analysis of the semi-structured interviews was conducted after intervention. Themes and categories emerged about the participants' experience of occupational therapy. Here we can see improvements in the self-efficacy scores for the participants. We can see the improvements in the diabetes self-management scores for all participants. There were improvements in the performance scores of each participant's personal goals. Simon began to go out more with his family and reduced his portion sizes. Mandy started standing up for herself at home, began singing with a band and joined a gym. Thelma started doing her own housework and meal preparation, had a reduction in her care package and cut down on biscuits. Bob negotiated early retirement in work, bought a motorhome and took up photography whilst walking. All 4 participants demonstrated significant satisfaction with their improved performance. The semi-structured interviews revealed 6 themes. The Making Change theme was made from categories about the triggers for change, reminiscence about the past self, effort and experimentation to create change, and the self-reward and optimism inspired by making change. The Managing Myself theme included categories about taking ownership of medical management, establishing routines and gaining insight through knowledge and skills. The Lifestyle Choices theme included categories regarding making healthy choices through carbohydrate awareness, the barriers and enjoyments of healthy choices, taking pride in exercise and doing important activities. The participants identified the significance of supports, including partnerships, practical tools and the effect of lack of support. Confidence grew through assertive communication skills, fostering a positive identity and developing determination to act. The impact of occupational therapy theme was categorised by the therapeutic relationship, medicalised attention, being empowered through therapy, gaining a sense of well-being and developing aspirations for the future. This study is the first of its kind in the UK and endorses the existing literature from the United States that occupational therapy is effective in supporting self-management amongst diabetics. Occupational therapists could be utilised in enhancing diabetic services within UK primary care, especially for those who are struggling to enact diabetes self-management behaviours due to complex physical, psychosocial and environmental barriers. Occupational therapy can untangle such issues, empowering diabetics to solve problems that prevent self-management and increase participation in valued occupations, rekindling hope for the future. Occupational therapists should harness the profession's breadth of knowledge and skills in offering supportive strategies that empower and improve each person's ability to live a healthy and fulfilling daily life. As this study was conducted as part of a master's, the time frame for completion was an academic year. This limited the number of participants that could realistically be included and the depth of investigation that could be conducted. However, single case studies and small study numbers can be included in a meta-analysis as recommended by authors of literature found in the review. Further research is needed with larger cohort and to a greater depth using a case study approach, maybe as part of a PhD. Finally, no other studies discussed the impact of intervention on hope and aspiration for the future, elements needed for successful self-management, and this could be an area for further research. Thank you for listening. Please post any questions.